Hello, everybody. Welcome to the Research and Scholarship Collaborative Scholars Exchange. Tonight, we're going to welcome Dr. Ramesh Rajagopalan. Did I do that right?
Yes.
Okay. Thank you so much for your willingness to speak with us tonight. We are excited to hear your talk on machine learning and data mining for healthcare. You bring with us your expertise in applied engineering, and this is going to be a really interesting talk. I'm excited to hear about this, and for any of you listening who are interested in signing up to give a talk, I'm gonna post a link for you to be able to do that. And please make sure you visit the RSC as well. I will also post a link to make sure that you can do that too. I'll post it towards the end of the talk. And without further ado, you can take it away. Thank you so much.
Thank you, Dr. Dayanam, for that introduction and for this wonderful opportunity to speak on a topic of great interest. Welcome to all. Thank you for taking your time out of your schedule to attend the presentation. This is going to be a very interesting topic, and I've also done some research in this area as well. So I'll be presenting some of my research as well as a lot of a tutorial-oriented presentation on the overall topic as well. Okay, so let me introduce myself. I'm a professor in the applied engineering program at Keiser. So I teach in the online program, and I teach mostly in the electrical engineering part of applied engineering. So first, I do want to give an introduction on what machine learning is and AI is. So in today's world, we see AI everywhere, including our profession and our personal lives. And machine learning has come up to be one of the key players in a lot of fields, and healthcare being a major one at that. So when we define machine learning, it's basically the ability of computers to be able to learn without being programmed. So when we think about computer science and computer science related fields, we often think about the need to write a program in order for the computer to perform a particular task. But machine learning is more advanced in the sense it tells us the ability of a computer to learn on its own based on data. So more precise way of defining machine learning is to have things such as experience, task, and performance measure. So those are the three corners of machine learning: experience, need to perform some task, and then evaluate that task based on a performance measure. So if the performance based on the task improves your experience, then that is good news. So that is what machine learning is intended to do, is learn from the data and improve your experience. Today's talk is going to focus on healthcare, but before I get into healthcare, I do want to give a brief introduction to the overall applications of machine learning by putting it in context with a variety of applications that we might be familiar with. One application that we encounter on a day-to-day basis is how we manage our emails. And machine learning is at a big play in that as well. So it is learning based on how you're interacting with your emails. And so the learning algorithm is able to classify your emails as spam or not spam. And there might be cases in which it is not working perfectly. And then you might be going into the email and marking it as spam, which is when the machine learning is getting additional data that you labeled a particular email as spam, and it keeps improving its performance based on that experience. So watching you label those emails as spam or not spam, that is the experience part of the machine learning, and the actual labeling is the task part of machine learning. Here's another interesting application where machine learning comes into play. So if you were to buy a home, apply for a mortgage, for instance, so the machine learning algorithm is going to um, make decisions based on a variety of features. For instance, some of the common features there could be things such as income range, your credit history, your employment history, the amount of finances you have to make a down payment. So all of these becomes the feature vector for the machine learning algorithm. So then it is able to take this data and then label individuals who are applying for this loan as either they're good candidates or bad candidates for approval. So the goal of the algorithm itself is to make a prediction. So we use the word prediction very often in machine learning because what it does is it basically gives us a measure to base our decision off of. So here it is going to predict a particular applicant as either someone who's a good fit for your mortgage loan or someone for whom you might want to give a rejection. And another important part of machine learning is splitting the data into training and test data. So a lot of machine learning algorithms process what we call as test data, which is the data that it's using to learn about the particular problem and how to solve that problem. But then you present the algorithm with new data, which is called as the test data, which is when you're going to find out how well your algorithm does. That is another important aspect of machine learning is the differentiation between the training as well as the test data. So let me give you a brief overview of machine learning framework. So in general, as far as machine learning goes, we can summarize it using a simple function. So let's say we have a function y equals f of x. So y is going to be your output. F is the function that you're using to do the prediction, and x is the input. So this looks very simple in the manner that it is presented here. But in a lot of cases, these input and output vectors are multidimensional and they may have several features. So that is what makes machine learning interesting, challenging, as well as a lot more rigorous, is the dimensionality of the data. So given the training set of samples, the algorithm is going to then come up with a prediction function. And the overall goal of the algorithm is to minimize your prediction error. So then when you supply the testing data to the algorithm, it is going to run that prediction function on the test data to produce a new output. And the difference between the actual and expected is going to be your prediction error. So the overall goal here for machine learning is to reduce this prediction error. So if we were to summarize machine learning in a very simple manner, we can simply think of it as coming up with a function. And this function could be something just very simple as linear, or it can be more complicated multidimensional functions depending upon the complexity of the problem. So when we talk about learning algorithms, as far as machine learning goes, there are two broad categories of these learning algorithms. One is called supervised learning, and the other is called unsupervised learning. They all have their pros and cons, and depending upon the nature of the problem and the available data, one type of algorithm might be a better fit than the other. So supervised learning is the easier category of machine learning algorithms. So in supervised learning, the training data usually includes the desired outputs. Unsupervised learning is a little bit more complicated because the training data does not include the desired outputs. So here we see various subcomponents of a learning algorithm. And some of the important components here is the prediction model. So the prediction model is what we talked about previously, which is similar to a function that the algorithm has to come up with in order to minimize the error. And then it puts the expected label on the data. So we will go over this when we discuss specific healthcare applications later in the presentation. So the labeling could be, as we discussed before, a very simple label as spam, not spam, high credit risk, low credit risk. Or in terms of healthcare, it could be a high-risk patient or a low-risk patient. Now, labeling this data correctly is again an important performance measure of how well your algorithm is doing on the test data. So in terms of the overall architecture of machine learning, we can kind of describe machine learning in terms of three components: representation, evaluation, and optimization. So representation is basically the kind of model that you're using to represent the learning algorithm. So some commonly used machine learning representation techniques include decision trees, a lot of graphical models, as well as neural networks. Neural networks is, again, another sub-area of computer science, and they have been used for several years now to solve a lot of computer science related problems, and they find a lot of importance in machine learning. So that is one component of machine learning. Another component is evaluation. So this is going to tell us how well your algorithm is doing, what parameters you need to tweak, or how you can improve the efficiency of the algorithm. All of that would be determined based on your evaluation measures, such as accuracy, which is a very simple measure that tells us how accurately your algorithm performs. It could be something as simple as how often it correctly classifies or labels the test data. There are also other specific performance measures, such as cost and utility-based measures, as well as precision and recall. So that is the second part of machine learning. And the third part is optimization. So optimization is, again, another big area of computer science in general, but it is also playing a big part in machine learning. So optimization depends upon the kind of algorithm you're designing to do the optimization for you. So there are a variety of algorithms that can do the optimization, some simple algorithms based on mathematical techniques, and other more advanced algorithms based on genetics and computer science related evolution concepts to do the optimization. So overall, when we think about machine learning, these are the three main areas we are focused on. And depending upon the kind of problem and the amount of data and the other parameters of the problem, these could be very simple, or they can be very, very complex, or a range in between. So supervised learning is the most common type of machine learning method. In this method, what we are doing is we are learning a model using training data. So we are collecting data, and then we are coming up with a model, and then we are using that model to learn about this data. Okay, so we are learning about parameters, we are learning about features of the data, complexities of the data. So that's why the word learning is very important here. And then once the learning is complete, we are going to test this on some unseen data to assess the accuracy of the model. So a very simple way in which we can determine accuracy is a ratio of number of correct classification by total number of cases. So let's say we have test data for patients with breast cancer diagnosis that we have collected. And now we have new data. And so how many of these patient records does the algorithm correctly classify as breast cancer or breast cancer risk versus none? So that tells you how accurate your machine learning algorithm is. I do want to talk a little bit about decision trees. It's probably one of the most widely used models to represent machine learning systems. A very simple example that we often use in our research and as well as in our classrooms and teaching is an example where you're looking to go to a restaurant and you have multiple choices, and you're deciding what decision you need to make. So again, you have all these parameters you need to consider. For instance, what is going to be the wait estimate at this restaurant? Did I make a reservation ahead of time? How hungry am I? Can I just wait around a little bit and explore more options? What is the rating of the restaurant? Does it have the kind of food I'm looking for? So again, all of these become nodes in this tree. And these nodes, again, have various choices you can make, and you can allocate performance measures to these choices. And based on your optimization algorithm, you might be able to travel a path along this tree to get you an answer as to yes or no, or what your decision should be. So this is a very simple example, but you will find that decision trees appear a lot in various machine learning problems. It's one of the simplest and one of the most widely used methods in machine learning. We also need to talk a little bit more about performance evaluation, and this again becomes especially important in healthcare applications, because this is machine learning for healthcare. So sometimes you're making decisions that are going to have important ramifications for the patients. It could be life or death decisions, and so the importance we need to focus on predictive accuracy is kind of magnified in healthcare applications. Efficiency is another commonly used parameter, which talks about how much time we need to construct the model and use the model. Robustness talks about handling noise and missing values. This is a big research area in machine learning, is the ability of the algorithm to handle data points that might be missing or data points that might be corrupted. So how robust is your algorithm in that context? Is it able to spot out noise and kind of reject data points that might be misleading or that might be noisy? Scalability and interpretability are two other important performance measures in machine learning. So interpretability tells you how much you can understand the model and how much insight you can get from the model. So these are some types of parameters and some types of components or subcomponents we would be interested in when we talk about performance evaluation of machine learning algorithms. So now I have given a brief introduction to machine learning. I hope you're enjoying the presentation so far. If you have a question or a comment, feel free to raise your hand or type a comment in the chat session. I would be more than happy to answer any questions or comments. So now we can move into the second part of the talk, which is the main focus of this presentation, is healthcare and the roles that machine learning, data mining, and AI are all playing in healthcare. So healthcare sector over the past, I would say 10 to 20 years, has been transformed by the ability to record and digitally process massive amounts of information. So why machine learning, or how machine learning comes into play in the context of healthcare, is that machine learning provides a way to automatically find patterns and make some interesting observations and reasoning about healthcare and about the data. So it is going to advance, and it has advanced healthcare profession, and it's going to enable healthcare professionals to move to a more personalized care. So in the healthcare field, this is called as precision medicine. So one of the goals of machine learning is to improve the experience for the patients and provide them a more personalized care. So if we look at evolution of healthcare technologies, as I said before, this has rapidly evolved over the past 10 to 15 years. And when we talk about electronic healthcare records or EHR, this has increased tremendously, especially since 2008. So with the widespread adoption of electronic health records comes massive amounts of digital data. So we have these large data sets on patients and on all our analysis and observations we did based on the patient data. So for instance, MIT lab for computational physiology has de-identified, for instance, health data from about 40,000 critical care patients. So that is a massive amount of data that is available to us engineers and scientists in order to work with and make machine learning improve the nature of healthcare. Again, it comes with its own challenge, which is where data mining comes into play, because some of this data can be massive and it could be noisy. It could have missing data points. It could have some outliers. And so data mining technologies need to focus on how to not only process this data, but reduce the amount of error these algorithms might make when processing that data. So we also need to talk a little bit more on the motivation and the need for machine learning and data mining in healthcare. So as I mentioned before, one primary challenge is the massive amount of data. So there is large data sets, and so obviously we need sophisticated data mining algorithms to process that data. Demographics, vital signs, lab tests, medications, notes. So this, for instance, gives us the range and the variety of data that is available in healthcare. So for instance, one interesting statistic about this is we have data on nearly 230 million unique patients since 1995. And since 2008, most of this data has been in the form of electronic health records. Another interesting aspect, as well as challenge, when we talk about data mining with respect to healthcare is with the evolution of digital platforms, the data has become more diverse. For instance, now we have data about patients not only collected during lab tests or specific visits to hospitals, but this data is widely now becoming available via wearable sensors that can send data to your smartphone to tell you information about your vital signs, data that is available in social media platforms. So the variety and diversity of digital data is useful, but at the same time, it's also challenging because we need a uniform method to combine this data, or a standard which everyone agrees upon to process this data. So that is another motivation for machine learning and data mining when it comes to healthcare applications. So there's a lot of industry interest as well when it comes to machine learning in healthcare. One is an interesting technology that is developed by IBM Watson for oncology. I'll be going over this shortly as to how helpful that was. So deep learning technology can be very helpful in the sense it can save lives, especially if you're able to detect curable diseases early in the process. So that means we are able to provide care to the patients much earlier than would have been the case if we did not have machine learning, or if we did not have ability to make those predictions. So here are some of the key benefits of using machine learning in healthcare. One is we can improve the accuracy of diagnosis, prognosis, as well as risk prediction. We can focus on improving the quality of care, the outcomes related to health, and also while making sure we are finding ways to reduce healthcare costs. We can also do automatic detection of relevant findings, especially in fields such as pathology and radiology. Another area where machine learning shows up in healthcare is to how we can optimize the performance and efficiency of hospitals. So things such as resource allocations, making decisions about whether you have to admit patients into ICU, maintaining an optimal patient flow. That is another way to do this. Reducing medication errors and adverse events, another important point where machine learning comes into play. So we have a comment from one of our members, Michael. Reliability and safety is extremely important. The question is how to ensure safety and accuracy of results and address uncertainty. See, this is a very good question. And the way in which we place priority on safety and accuracy of the results is also going to depend upon the nature of the healthcare problem and the quality of data you have. So in most cases, the training data, there are metrics that tells you there are metrics that tells you how good your training data is. So if your training data is not meeting up to those measuring metrics, that means your learning algorithm is not ready to be deployed for testing or deployed in real time. So this is, again, an evolving area of research. But my short answer to this question would be based on the quality as well as the significance of the training data you have available, so that you can incorporate safety and reliability into the algorithm when the algorithm is learning from the training data. This is another example that I was talking about on machine learning technology that was developed by IBM Watson. So they had a cluster of 90 computer servers and several terabytes of RAM. RAM stands for random access memory. That tells us that they have significant storage capacity. So IBM was famous for machines with incredible processing power and memory, which are important needs for implementing these machine learning algorithms. So what IBM Watson developed was an AI-enabled question answering system. So this question answering system is using information retrieval, current knowledge, and automated reasoning in order to answer some important questions about patients or about a particular disease that is being managed. So in terms of what or how this can benefit the physicians is that this can contribute to clinical research as well as clinical decision support system. So, for instance, a physician could pose a clinical question to IBM Watson, and the machine learning algorithm and the data mining technique then mines the patient chart. It is going to examine all data sources, and then it will form some hypothesis for those questions based on the findings. So then one example output for this sort of a question answering system might be that the IBM Watson machine learning algorithm is then able to provide a list of individualized confidence scored recommendations for that particular clinical question based on the data as well as available research. So currently, this system is being used for oncology research and treatment, especially in breast cancer as well as prostate cancer. This is gaining significant popularity among physicians. Another interesting application of machine learning in healthcare is fighting the opioid crisis and what we can do to reduce the harm that results from opioid crisis. It's again a major healthcare issue. Here you have three important categories in which machine learning can help us with this task. One is risk modeling. Another is opioid dashboards, coming up with dashboards that can give us information that we can use to fight this crisis, as well as present more personalized treatment algorithms. So for instance, let me talk a little bit about what risk modeling looks like for opioid use disorder. One recent research that was done in this area included a study from several Medicare beneficiaries without cancer. And the parameter that was used to collect data was that they should be filling at least one opioid prescription within 2011 to 2016. So this was done a while ago, but still it is one of the first and one of the earlier and most beneficial research that was done in terms of risk modeling for opioid. So the goal here was to train your machine learning algorithm to validate a risk model. So we want to identify patients who are at high risk for developing opioid use disorder. So in this machine learning algorithm, for instance, there were 269 potential predictors that were developed, including important characteristics of interest and relevance, such as sociodemographics, health status, what is the pattern of opioid use by these patients, what is the factors that are affecting the provider level, as well as regional level aspects of this particular problem. So this data was collected from, again, this is massive data that was collected from a wide cohort of patients over several years. So that itself tells us what a challenging task we have here, both in terms of developing the machine learning algorithm as well as processing the data. So the data for this research was analyzed in 3-month periods to come up with opioid dashboards, for instance. So these can provide an overview, for instance, of local or regional data regarding opioid misuse metrics. We can also incorporate other interesting and relevant factors such as geographic and socioeconomic data. So we can use these to visualize the data and identify populations of concern. That is, again, an important task that we need to do, because if we go back several years where machine learning was its early stages, or we didn't have machine learning algorithms, these have to be done on a case-by-case basis. And so these tools that help us kind of club this data together, visualize regions of interest, visualize populations of concern, are going to help us a lot in reaching out to people, identifying risky individuals, and also improving the quality of care for them. So this allows for rapid analysis of large amounts of data to aid in our decision-making process. So here's a simple example of what a dashboard would look like. And this was data collected from a county in Indiana. And this visualization gives you a lot of interesting and rich information, such as positivity rate over time, positivity by drug. On the right side, you can also see other interesting information about the socioeconomic background, the region in which they are coming from. We can also include other interesting categories such as age range of patients whose data is being analyzed. And this dashboard helps us with some of those decision-making and prediction tasks that is at hand for a problem like this. The research they did also came up with some future enhancements for this particular problem. So the first enhancement is a better identification of patients at risk for opioid use disorder. We can do that by improving our risk modeling. So when I spoke about machine learning early on in the presentation, I talked about the 3 important components of machine learning, and one of them is modeling. So coming up with a good model is important in order to do better with this problem. Ability to identify a population that might be of higher risk, then ability to determine the best intervention strategies or medical intervention for those elevated risk factors. So that is another area for improvement. Engagement of patient with AI-driven chat agents. So now we see that this has become omnipresent in our lives, whether it's teaching or research, your professional or personal lives. We have AI-driven chat agents that can help us with our questions. So how can we incorporate that to assist our patients, as well as how can we develop personalized treatment algorithms based risk models? So those are some of the enhancements that can be done in this area. Another popular application of machine learning is in the area of radiology. So Google, for instance, is developing models that can more accurately detect breast cancer and lung cancer, and how we can do this in comparison to the human radiologist counterparts. So in order to do this, again, there are algorithms that we need to design or is being designed to evaluate images. So these are images that are coming from the CT scans, and many of these can also be three-dimensional images. So the 3D data, it allows for a more accurate identification. So again, this is becoming and this is in fact now one of the very popular areas in healthcare where machine learning has come into play. So it also compares differences in a patient's previous scan. So for instance, that can be used to measure lysosomal growth rate. So you can use this to flag studies that may need additional intervention by a radiologist, for instance. So those are some additional benefits that can come out of this, in addition to predicting and classification. So prediction and classification are perhaps the two main tasks that are involved in healthcare. But again, doing things like early identification, coming up with better intervention strategies, those can also have tremendous impact on improving the patient outcomes. So here is an example application of how we can use machine learning to improve the accuracy of diagnosis and risk prediction, especially in chronic diseases. The data visualization is also important. So this sort of data visualization provides clinicians a comprehensive overview of risk levels, and risk factors, along with potential interventions. I also do want to share an anecdote where we professors were working with clinicians and physicians to do research. And one of the things that we learned in terms of our research in machine learning and data mining is just how overwhelmed physicians are with respect to the kind of task that they have to do with patients. So what we learned from that is physicians do not have the time to look at raw data. They do not have the time to understand the intricacies of the data. So it is up to us, researchers, engineers, and scientists, to present this data in a way that is useful, both for the physicians as well as the patients. So that is, again, another main area for research and development. Another interesting application of machine learning in healthcare is optimizing hospital processes. For instance, early and accurate prediction of patients' diagnosis-related group. This can help hospitals in determining key resources. Is there a demand for scarce hospital resources such as beds and operating rooms? All of this can be better predicted. Especially this can become extremely beneficial in some of the extreme events, such as like if we had a pandemic or if we had a sudden outbreak of a disease and hospitals are getting overwhelmed, or maybe there is a natural disaster and hospitals are getting overwhelmed with patients. So how can machine learning come into play in terms of making some key decisions here? To automate detection of relevant findings, that's, again, especially important in cancer diagnosis. Pattern detection approaches have been widely successful in this regime. So they are of interest in digital pathology slides, And it has turned out that with proper training and testing, these algorithms can work surprisingly well to detect cancers. So automatic detection of anomalies and patterns is valuable, especially in identifying key pieces of patient health data that we might otherwise be missing out on. ICU admission decision, another popular area where machine learning can help with healthcare. So for instance, let's consider an example where an emergency room in a hospital measures 17 variables. Could be something like blood pressure, their weight, age, etc., for newly admitted patients. And based on this, a decision needs to be made whether you need to put the patient in an intensive care unit. Now, because of the high cost of ICU, as well as the critical need for ICU, the patients who may survive less than a month are given high priority. Now, this is easy to say, but difficult to implement because the problem now becomes how do we use all this data that has been measured to predict high risk patients and discriminate them from low risk patients. Again, one of our participants talked about the need for safety and reliability. This is an area where that comes into play because a fatal error here, such as wrongly labeling a high-risk patient as a low-risk patient, may end up in a disaster conclusion for that particular individual. So this is, again, a scenario where approximately close to 100% prediction accuracy is needed before making these critical decisions. So another area that I wanted to share with you is an area in which I had done some research previously. When I was with UC San Diego, I worked with my fellow colleagues as well as physicians in order to develop machine learning and data mining algorithms to improve quality of lives for persons with Parkinson's disease. So Parkinson's disease is a complex movement disorder, and falls, for instance, is a common concern or an area that needs attention for people with movement disorder. So we were working to develop fall prediction algorithms and to identify individuals that might be at high risk for falls. So here we had to do wearable sensors. We have to do machine learning. We have to use sensors for analyzing data about gait. Inertial sensors such as accelerometers needed to be used to measure that information. Hand motion techniques, analysis of finger tapping and tremor tasks. So that is another important component here. So once this data is being collected from those sensors, we then need to develop machine learning algorithms in order to predict patients that are at high risk. So here is a simple example where machine learning and AI can come into play in terms of designing a fall prediction system. So in this system, you might have sensors that the patients are wearing that is sending data to smartphones, but there can also be data that is collected from environmental sensors that can tell us if patients are, like for instance, when patients are entering and exiting beds, are they experiencing any fall risk related symptoms? So then we also need a clinician interface that can provide high level information about the physiological health of these patients, and then a patient interface, which could be a mobile app for the patients to visualize their data and give them more personalized care as to in which areas they can improve, for instance, to reduce their risk of falls and to manage other symptoms of their diseases. So again, data mining is an important part here because we have data from wearable sensors, we have data from environmental sensors. For instance, data related to acceleration are usually like very massive because they're collected continuously over long periods of time. So this is where engineers and scientists, we need to design processing techniques and data mining techniques to extract features from that data that might be of interest for this particular problem. So for the study design for fall prediction, we used what we call as freezing of gait. A freezing of gait is basically a fall that occurs because of improper balance of posture. This can often happen when a patient's feet is glued to the floor, and that usually results in a fall. So the amount of data that we used was collected from 41 patients with Parkinson's disease, 26 of whom had freezing of gait symptoms. And these participants were asked to wear these notch sensors and perform some walking tests to collect acceleration data that will enable us in identifying this FOG that is very common in patients with Parkinson's disease. So here is a sample example of data that we collected. So it shows various important acceleration-related data, gait, balance. Those are important factors to consider. So this sort of data was collected from notch sensors that were placed in the lower extremities of those patients. So then based on this data, we need to develop, or we did develop a machine learning algorithm for fall prediction. So these are some terminologies that you may come across when you're learning about machine learning. Support vector mission is a commonly used algorithm, supervised machine learning algorithm that can do a very good job at risk modeling. So because here our overall goal was to detect freezing of gait, so we can identify patients who are at high risk for falling. Another interesting kind of decision model that is often used in healthcare systems is a fuzzy rule-based decision model. So what this does is it kind of takes into account multiple factors and implements a decision-making system. An example here would be like, for instance, if a patient has a history of less exercise, disrupted sleep, low blood pressure, as well as gait abnormalities. All of these are combination of factors that could potentially put this individual at high risk for falling. So if this is going to be the factors that we are combining in this decision-making model, then the outcome should be that the model should send an alert to the clinician saying that, okay, based on the data we collected, this patient has high risk factors in multiple categories and is more likely to have a fall or to encounter a fall, and we need to do some sort of intervention to prevent that. So that is another popular decision-making model in machine learning. So for future research in this area, one of the areas that we are lacking is developing proper user interfaces for clinicians and patients. As I mentioned before, clinicians are extremely busy with their obligations in the healthcare industry. So they have very little time to understand the intricacies of the data. So we need to present the most critical data that they can quickly look at and make recommendations for patients. Information fusion is another important area of for further research. So how do we combine data from various sensors, because they may not be compatible with each other, and so there are challenges there in terms of efficient ways in combining the data. We also need to focus on enriching data collection, especially with research projects related to healthcare. We need to make sure that the patient population that we are working with is representative of that particular problem that we are addressing. So for instance, if we are looking at fall prediction, it's not only people with movement disorders, but aging adults, people with other chronic conditions, frequent fallers. They may all be a part of this risk population. So when we talk about AI and machine learning in healthcare in broad, there are lots of unique challenges. As I said, some of these are life and death decisions or life or death decisions. So we need robust algorithms with very high prediction accuracy. We need to implement the checks and balances into machine learning algorithms. So this is where we shouldn't let these automated algorithms take over what a physician or a clinician might recommend for that patient. So we need fair and accountable algorithms. So again, discovering disease subtypes is also another area of research. For instance, an important question that is posed in healthcare is how can we characterize people who are likely to be readmitted to the hospital? So that is a sub question of a particular healthcare related problem. So how can we develop algorithms that can answer that question? With respect to data mining, some of the challenges becomes in some cases, there might be data that is not massive. For example, there might be a rare disease or a disease that is just evolving and clinicians are still trying to learn about that disease. So in those cases, the data that is available might be small. So in that case, we might be looking for other avenues that can help us, such as learning from other possible data sources, for instance, healthy patients. Missing data is a problem. Varying time intervals for the data can be a problem. So again, how can we address those gaps to make our data mining algorithms more robust? So some of the barriers, although machine learning and data mining has rapidly evolved, some of the barriers still exist in terms of how we can successfully integrate this into healthcare systems. One is the need for data sharing agreements and sensitivity, because patient data has to abide by the HIPAA regulations. So any kind of research study algorithm that is processing this data, we need to make sure that we are taking into account the sensitivity and confidentiality of the data. There are computational challenges in terms of the computational power we need. Another important challenge, or perhaps the most difficult one, is the electronic health record software is kind of universally accepted standard. So it's very difficult to modify. So how can we look into techniques that can integrate other data mining techniques or other digital data platforms with the electronic health records? So interoperability, again, here is important to keep in mind when we talk about these barriers. So the future of machine learning, data mining, and AI in healthcare, it looks very bright because these technologies are continuously helping us advance and enhance our livelihood, especially in diseases such as breast cancer or lung cancer, radiology, pathology. The automatic detection and prediction and early identification has helped a lot in identifying patients early on and improving care for them. So we need to seek to understand and utilize AI when it increases the efficiency and improves outcomes. But at the same time, we need to be cautious by implementing checks and balances into our algorithms to ensure that the technology never really exceeds our humanity. So that concludes the presentation. If you have any questions or comments, I would be happy to engage with you.
Please feel free to raise your hand, unmute, or post in the chat. Give you a moment. This has been amazing and a lot to think about. While some people are typing their questions, I am going to type the links to the RSC here and also to sign up for presentations. And you do have a question just posted.
Yes, Joyce asked a question, is it possible to read the study on Parkinson's? Yes, if you can send me an email, I can give you links to some of our work in that area. And that would probably be a lot helpful. Also, if any of you in audience would like to chat further about this topic, explore some possible opportunities for research, anything of that nature, please feel free to email me. I'm always open to collaborations, learning, and um, advancing this field.
Yes, this has been a wonderful, wonderful presentation. I really do appreciate you sharing your knowledge with us. This has given us a lot to think about. I'm interested also in reading more about this and having a little bit more time to digest this. It's a very new area for me. And I hope that we will hear from you again in the future. It was very well done. Thank you. Thank you so much for your time. Thank you, everyone, for attending. I really appreciate you all.
Thank you so much for the opportunity. I thoroughly enjoyed this format, and I'm so grateful for this opportunity to share this with the audience. And I'm surely looking forward to future presentations along these lines.
All right. Be well. Good night, everybody.
Thank you. Bye.